15, 20 years ago, I had a work-related injury. Taking Tylenol or taking something to ward off the pain took care of it for quite a while. The pain in my hips and my legs were so intense. I couldn't walk, I couldn't sit, I just couldn't get comfortable. So that's when I came to Dr. McFarland.
The patient has bilateral lysis, which is basically a stress fracture that's occurred in the bone, and it's created severe instability. The patient has a grade 2 spondylolisthesis, so that's creating severe spinal stenosis for the patient. And to complicate it, the patient has had a massive disc herniation and has severe compression of both the L3 and the L4 nerve roots. We're also going to try to perform her procedure through an LES approach.
I went home and I guess like everybody, I Dr. Googled it to see exactly what he was talking about. I saw a lot of information where people are in the hospital 2 to 5 days. You're on, complete rest for 6 months. And I'm thinking, oh my gosh, this is gonna be the worst.
When we do the fusion, we're going to do this basically through a laminectomy incision. We're going to be able to place a posterior lumbar interbody fusion cage, which is a rotating device where we can use a very small opening into the disc space. And we're going to place our screws through a midline approach utilizing Spine Frontier's Remind midline screws. And these have more strength than a typical pedicle screw that we place, so we're going to get a more robust, stable construct in a patient that is clearly very, very unstable. And she's going to be discharged home about 2 hours after the procedures. The main thing for me is just patient success.
Tomorrow will be 2 weeks since I've had surgery. Overall, there's been nothing. No pain. It's totally gone. I mean, it was like flipping a switch. Before, I'd have to take a couple steps and stop. This morning, I went upstairs to find my tennis shoes and I just went right up the steps, didn't even think about it. So it's totally night and day.
Everything we are doing is moving in the direction of being less invasive to the patient in general. And we're continuing to change what we do. We're continuing to try to become less invasive and continue to see patients do better and better and better with these techniques. And once you start seeing that as a physician, that's what you want. We try to treat people like we would want to be treated ourselves.
If the need comes, I will do it again and I'll come back to Dr. McFarland. Don't waste any more of your lifetime in pain when this is so easy, is so fast. Less exposure surgery is the way to go.